Hello all. Just a little technical difficulty there. Happy Monday. Good to be with you again today. Nice to see the sun out and everybody warming up a little bit. Today we're going to talk about COVID numbers, and we're going to talk about vaccinations, and of course we're going to take your questions. So let's get right to the COVID numbers. City of St. Louis, number of new cases is currently averaging 26 new cases per day in the city of St. Louis. So we've been in the low 30s or high 20s for about the last week or 8 or 9 days. That's good. We're happy to see that the number is down, and also happy to see that it appears to be somewhat sustained, although a week is not a long period of time. Now, in terms of people in the hospital, and of course, as you know, these are regional numbers for the 4 major hospital systems. Number of people in the hospital today who are either COVID positive or suspected positive is 367 people. When I say today, those numbers are 2 days old, but they're reporting today. 367 people. The number of people in the ICU is 83. That number is seems to be kind of stubbornly high. It's been there for a while. Number of people that are in the ICU that are on ventilators, 58. Again, of course, better than previously, but still a fair number of people who are really quite ill in the hospital. And then the number of people who are admitted to the hospital, and this is a 7-day average number, is 43. So good numbers, like really all across the United States and across the world. And I think that when we look at it, it's attributable to, the very, very serious numbers and extremely high cases that we had from about Thanksgiving to New Year's. And then I think the public just got serious about mask wearing, about social distancing, because that spike that we had was quite scary and quite troubling. So in this last 6 weeks or so, we have seen the numbers come down significantly, and we're very encouraged by that. We're very encouraged about the vaccine possibilities and the number of people being vaccinated today. Still a very extremely low supply of vaccine across the country, in the state of Missouri and here in the city of St. Louis, although we've gotten a little uptick in the last week or so. Good news, over the weekend, starting last Thursday, Friday, and Saturday of last week, the health department, along with many volunteers, particularly people from SLU, our medical corps, a lot of just friends and neighbors who volunteered to help out at the vaccination event. We vaccinated 4,902 people on their second doses. So let's just call it almost 5,000 people last Thursday, Friday, Saturday. Then on Sunday, our health department and our partners vaccinated about 350 people at the St. Louis Housing Authority. The St. Louis Housing Authority on Page there near Grand. And this was all older folks who primarily who live in public housing, who were brought to that location to receive their first vaccination, and they will receive a second vaccination in a few weeks per normal. So we had a good 4 days where we vaccinated, almost 4,300 people. No, excuse me, 5,300 people. And so very encouraged by that. We also, in probably tomorrow, will be sending an invitation to people who have signed up on our registry. We'll be sending an invitation to those people in certain zip codes, and we're kind of saying north and then south zip codes, to attend a vaccination event. There'll be one on Saturday, and then there'll be one, we think it will be the following Wednesday. The one on Saturday will be north. The one a few days later will be south. So we're trying to work down our registration list. We will be inviting those people in the order in which they signed up on the list by zip code, and then in that order, who are 65 and older or who have represented that they have underlying health conditions. So we expect to do about 1,800 first-time vaccinations this coming Saturday, and we hope to do a similar number the following week, likely on Wednesday, but that's still, those details are still being worked out. So we are going to continue with the vaccination program. We are also continue to check Walgreens, because we believe that Walgreens will again this week be doing some vaccinations. It's a limited number, but every little bit counts here. And then we are continuing to work to get vaccinations in CVS stores as well. The key is not that we could get them in the CVS stores if we could get the supply of the vaccine to the CVS stores. Same ditto for Walgreens. So I think that's very important that we are able to have a lot of different locations where people can get vaccinated. And of course, you have to have an appointment in order to go to any of these places. It's not just line up down the block and hope to get in. You have to register for an appointment. Anybody who is not able to be online, you can call the health department. So that's good news. I think that's reasonably good news about vaccinations. We're really expecting, and when I say we, this is the medical professionals are expecting that the Johnson & Johnson vaccine will be approved here in the next week or two. And when that happens, to the extent there is supply of the Johnson & Johnson vaccine, that's potentially a game changer, because it's a one-dose vaccination. And so that makes it much easier for many folks. And it makes it, of course, easier for the folks administering it as well. And some folks have said, well, it's not quite as effective as the other two. But bear in mind, the effectiveness here has to do with making sure you don't have really bad symptoms. So if you can still get the coronavirus under any of these vaccines, although it's very small, the real thing that is the advantage here to the vaccine is that if you get a case and it's very mild and it's like having a cold, well, that's a lot better than getting a case, getting really sick, ending up in the hospital, ending up in the ICU, ending up on a ventilator. And that's what the biggest things that the vaccines prevent. So I think in a month I hope in a month we'll be having very different conversations about vaccinations. That's what we're hearing from the federal level, and so hopefully that will turn out to be correct. So that's all I have for today. Do we have questions?
A couple questions, Mayor. So Paula has a question about when do you think we will, as she writes, turn the corner on COVID-19 cases as more vaccines become available?
Well, Paula, we are turning the corner right now, although we still have to worry about these variants that are out there. And, you know, I listen to Dr. Fauci and all the professionals and the data on this as well. So I think we are turning the corner. The numbers are much better than they were. And with the vaccines on the horizon, you know, hopefully we will get everyone over 65, everyone who has underlying health conditions, everyone who is willing to take the vaccine, hopefully we'll get them vaccinated within the next couple of months. And so here we are, almost the 1st of March. We're talking March and April, May, and this summer hopefully we'll really have turned the corner.
Deborah is 71. Her husband is 72. They haven't received their vaccine. Any advice on how they can get vaccinated because they are eligible by age?
They are eligible by age, Deborah. I would say, one, be sure that you're signed up on all the lists. I'm sure you are. That means BJC, SSM, Mercy, St. Luke's, the city's registry, the county's registry. Check Walgreens, because I'm telling you that the Walgreens have some doses now. And don't forget to go on the state's website where they list all of the locations where they're having mass vaccination events. Some of them are not too far away. In fact, last Saturday there was one at Umsel. That's not far, just right outside the city limits by a few blocks. So I think, unfortunately, you just have to continue to be persistent and continue to check those sites. If you have a physician, you probably do, and that physician is affiliated with a hospital, most likely is. Of course, that's your first good shot at it. I had some friends this morning who are they're a little bit older than you guys, and they texted me and said, "Oh, we got our appointments," and they're affiliated with BJC. Their doctors are, and they were able to get appointments through BJC.
Debbie, who's watching, has a question about geographic restrictions on the vaccine.
Mm-hmm.
Are city residents allowed to go to the county and vice versa in other locations to get the vaccine?
You are. You can't go to Illinois. Illinois is saying, hey, we got a dosage based on our vaccine based on our population. So yes, you are. There's this city-county line is not a barrier at this point.
Dorothy has a question about people who don't have a computer or the internet.
Mm-hmm.
What is a way for them to get registered to be notified about vaccination opportunities?
Well, I think there's a couple of ways, Dorothy. One, call the health department, 657-1499. You can get registered via that. Two, see if there's someone that you might know who does have a computer who can help you get registered, because that is the easiest way to register in a lot of different places. And if you have a smartphone, you can register using your phone. If you don't have a smartphone, you don't have a computer, you don't know anyone, then you really have to call.
Dana, James, and a couple of other folks submitted questions about COVID-19 numbers coming down,
Mm-hmm.
and when the city will begin to have conversations about lifting restrictions on bars and restaurants.
So, James, we're having conversations about that. We haven't made a decision on that yet. My preference would be to come together with the county and do something similar with the county. Just about a week or maybe 2 weeks ago by now, the counties brought their bar and restaurant guidelines in line with the cities, in line with what ours has been all along. I do think it would be most desirable for us to move in unison on that. Again, we're one region, so the city is having conversations about that. I don't see a day that we're going to not require masks, and that let me say this in the other way. I believe we're going to continue to require masks, and I believe we're going to continue to require social distancing in bars and restaurants. Now, whether or not we could change the early closing time that we have right now, or the occupancy limits, those are all things that are being talked about right now.
Victor has a question about vaccine supply.
Mm-hmm.
Do you think that the state and Governor Parson need to hear more from city residents to increase what we're currently receiving in terms of allocation of vaccine?
Well, honestly, I think they have heard from us, but I would never discourage you from communicating with your state representative, with your state senator, because those folks are there in Jeff City day in and day out right now up until about the 15th of May. And by the 15th of May, hopefully we'll be in a much better place here. But I think everybody wants wants more vaccine, and it should be coming.
A couple of viewers today, Mayor, asking about available assistance from federal dollars for rental or mortgage relief, and if the city is still offering that.
We are. Absolutely, we're still offering it. I think we have a couple thousand people, a little over 2,000 people, that are still on the list from the first round of money. We're trying to work through those folks. We expect to roll out soon an improved, I'll say, an improved registration where you can upload your lease, where you can upload the information that you need. We're hoping that makes this a little easier. Landlords can also help their tenants with this process. So the city has about $9 million for the second it's not CARES Act, but for the second federal allocation. And then the state has over $300 million. So we have to work through this $9 million first. We want to help as many people as possible, keep as many people in their homes as possible. And then after that, you would have to be applying through the state program.
Susan has a question, who's watching about summer rec and summer camps for kids in the city this summer. Does the city anticipate offering opportunities for kids this year?
We do. We're working through that right now and to see what can be offered, what camps can be offered. The sign up for that usually is in March, middle of March to the end of March. I know some parents are already thinking about that, but based on what's happening right now with the numbers, we are thinking that we will be able to offer some recreation programs for kids.
Arnold's question, generally speaking, when will we start to see vaccines available in South St. Louis?
Well, Arnold, you mean given in South St. Louis? You know, there's vaccines available right at, I don't know about right now this minute, but at the Shrewsbury Walmart. We had, as I mentioned at the top of the hour, we vaccinated over 5,000 people, 5,300 people this weekend for second doses and some first doses. So I think, you know, you've got BJC, SSM, St. Luke's, Mercy, the city's vaccination events, the state's mass vaccination events. So there are vaccination events going on, but I recognize certainly they're limited by the vaccine supply.
And I think the last question that I see right now comes from Mark, Mayor. Does the city have capacity to get vaccines that you do get into as many arms as you possibly can? It seems the city's been pretty limited by what it's receiving from the state.
When we receive vaccine, we get it into arms within a week or 10 days. So when we get the vaccine, and you know, you can tell we've done a lot of vaccinations, and we expect to do more. As I mentioned just a few minutes ago, we expect to do an event north this weekend. We expect to do an event south on a few days after that. We did 5,300 people this last weekend. We did 750 firefighters and police department folks prior to that. So when we get the vaccine, we're getting it out there.
That is all of the questions that
That's
I have
all?
for right now.
All right, it must be a nice day out there. Don't have a lot of questions today. Everybody wants the vaccine. Everybody's out of patience for it. I am very encouraged that hopefully soon we'll be able to have a lot more locations for you to get the vaccine. And if we're able to get a supply to Walgreens and CVS, Walgreens or CVS, either one, that will be a lot more convenient for a lot more people. You still will need an appointment though, no matter where you sign up to get your vaccination. So thank you all. I'm happy that so many people want to get the vaccination. I was at the grocery store yesterday, and I was waiting in line to check out, and there were two women behind me. They both had white hair. So I'm making an assumption that they were probably eligible for the vaccination, and they were talking about how they weren't going to get the vaccination. I didn't interrupt their conversation. I was really just overhearing it. But I think, many thousands and thousands of people now have had the vaccine without any severe adverse effects. Maybe a sore arm, maybe a little tired and, feeling a little punky. But, that is for a day, that's a very small thing compared to the possibility of getting a bad case of COVID. So, and if you are older, your likelihood of getting a bad case of COVID is quite a bit higher than a younger person's. So I'm glad a lot of people want to get it. Thank you all. Appreciate you being with us today, and we'll talk to you again in a couple of days. Thanks.